I forgot to start recording. I apologize for that. But so those are some of the main points that I wanted to touch on. If you don't, again, if you don't have any MRC apparel, we will provide them to you the day of, but please come, either in the apparel if you're clinical, or, you could wear your scrubs if you want to wear scrubs, whatever you feel most comfortable in, please come, come as you like, but just try to stay within those parameters. If any questions about clinic attire, please let us know. It's pretty straightforward. Comfy clothes, closed-toed shoes, that's all we pretty much require. Right. All right, so continuing the overview for the flu clinics, there will be ample and free parking provided for both of these flu clinics. This is actually a sample of the clinic map that was sent out for the FOP, so for the drive-through. There's a designated location where all volunteers are instructed to park. If you have any specific questions about that, again, please feel free to reach out to us at any time and we'll answer those questions for you. But this is one of those locations or one of those deployments where we will have, again, ample and free parking for everyone. So whether you drive, you're carpooling with another MRC friend, or you're driving alone, and it's fully accessible also by public transportation as well. And we have included those instructions in your deployment summary. So free parking, and they're both accessible via public transportation. But again, if you have any questions about either of those or anything I've just mentioned, please reach out and we'll try to get you the answers that you need. Just going over both of the clinics. So the first clinic is being held this Saturday, actually on September 30th at the Police Training Center. Arrival time is 6:45. We do stress arrival time being on time, please, because we do like to start the day on a pretty strict schedule, especially with the clinic or the pod manager, getting everyone together, giving their overview of what to expect from the clinic and that day. We just please ask that everyone arrive on time. We will be providing light refreshments and breakfast for the Police Training Center. So that'll happen within our registration time. And if you have any questions about that, please reach out to us. The clinic duration is set to run from 8 to 2 p.m. And we'll get into some more specific clinic details about this Saturday's clinic in a few slides from now. But the clinic for October 30th is being held on a Wednesday, and that is at the Fraternal Order of Police Lodge number 5. And that clinic will start at 12 p.m. Registration will be held between 12 and 12:30. Again, please be on time. The earlier you get there, the more time you have to get set up. You can kind of like relax, get yourself together, get situated before we start the clinic. Again, just like with the first clinic, the pod manager will give an overview of what to expect from the clinic for that day in terms of throughput with patients and how many patients to expect to come through to receive their flu vaccinations. Instead of lunch, we will be offering dinner for this clinic because this is an evening clinic. And as something small that we can do in terms of a thank you, we are providing dinner for you all. So dinner breaks will begin between 4 and 6 p.m. Myself and Elisa, and this goes actually for both of the clinics, myself and Elisa Jacobson, if some of you remember her, she is our workforce coordinator. Her and I will be working together, and we'll go ahead and break all staff at their stations and let you know either when your designated lunchtime is or dinner time is, and we'll just, if you have any questions about that, we can address those the day of. But her and I will be the only ones coming around to break you for either lunch or dinner or your breaks in general. But obviously, if you need to use the restroom, we totally understand. You can go to use the restroom, whatever you need to do. Just please let someone know so that we know whether either to shut down your station or replace another clinician in your stead while you're away. So it's just all about communication. That clinic is set to run from 1:30 to 7 p.m. In years past, we have wrapped up earlier than expected. It does happen, and we'll do our absolute best to communicate that with you throughout the clinic. If we happen to wrap up earlier, then we do. If we happen to wrap up on time, then that's what it is. We do stress and emphasize that commitment to either of these clinics. We do prefer that you're able to commit to the full duration of these clinics, just because the throughput with patients, the amount of just work that it takes to kind of make these clinics function as efficiently as possible. It does take a lot of staff, and we do need to make sure that we have support staff in place if you're unable to make it. or, you know, whatever the case may be. So we do ask that if you're committed to these clinics, you're able to commit to the full duration of the clinic. If you're not, please contact us and let us know. That's something that we can discuss. But yeah, with the throughput, with patients and all that, it's very important that you're able to be there for the full duration of the clinic. Okay, so for the first clinic, like I said, for this Saturday, September 30th, we'll be at the Philadelphia Police Training Center, and the agenda is as follows. 6:45 to 7, we'll do all staff arrival registration. We'll pass out any of the vests or apparel that you'll need for that day. Again, breakfast and light refreshments will be provided to you. I will say, if you have any dietary restrictions or anything like that at all, please reach out to us and let us know. However, I would always suggest you bringing supplementary, you know, whether it's snacks or meals or anything like that, just, you know, to make sure that you're covered as well. But we will do our best to accommodate if we can. From 7 to 7:10 a.m., we'll do a JIT or just-in-time training for all staff. And that is, again, when the pod manager will kind of get up, address the clinic expectations, go over the clinic overview. They'll identify who your clinic leads will be for that day, so you know exactly who to go to pertaining to any issues, concerns, questions, things like that. 7:10 to 7:45 will be the JIT with the full, with your individual staff training. So if you're a vaccinator, you're going to go off with the clinicians. If you're station assistants, you're going to go off with the station assistant people. Data collectors will go off with Bethany and things like that. And so that's kind of how we work that. So you get a full staff training, and then you get an individualized staff training pertaining to your specific job role and function. And that is really the time where you want to raise any questions, concerns, ask anything that, you know, maybe floating around, and maybe make sure that everything is addressed before you get the clinic started. And your point persons, again, your clinic leads will always be identified for you, so you know exactly who they are for the clinic. And there will be maybe an early potential start time for 7:45. This always kind of depends every year, just because this is a family-friendly run clinic, and so we try to best accommodate those as they arrive. If we have, you know, all staff has arrived and everyone's in their stations and we're all ready to go, we may let everyone know around 7:45, hey guys, we may start just a few minutes early. And there is a typo right here. It is not 8 p.m. to 2 p.m. I apologize for that. It's 8 a.m. to 2 p.m. And so we'll start getting everyone into their stations and ready to go, sitting down, and just make sure that everyone's prepared to start the clinic. That'll start the clinic at 8 a.m. We'll run until 2 p.m. Like I said earlier, it may wrap up sooner than expected, or it may end right on the nose at 2 p.m. Between 11 and 1 p.m., Elisa and I will go around and we'll do breaks. Again, like I mentioned earlier, we'll come around specifically to your station and we'll notify your entire station, like, hey, you guys can take your break. We will try our best to accommodate everyone in terms of preference. However, that's not always exactly possible, just because of timing and, you know, trying to keep, you know, the schedule in mind with the patient throughput that we have to do. We will try to keep that in mind, but again, breaks are kind of set to a certain point, so we can be flexible sometimes, but please just communicate to us if there are any, you know, anything that you like to address, or if there's anything that we could do to best accommodate you, we will try our best. Breaks for the lunch are about 45 minutes. And I'll show you the clinic layout in a few slides from now, but the rooms are right next to each other. So whether you are, you know, packing your lunch or eating the lunch that we will provide for you, the room is right next to her, and so is the restrooms. So everything is very closely situated for you, to try to make it the most convenient. And so that really gives everyone the opportunity to optimize that time for their lunch break. And again, I do just want to emphasize, because this is a very tight schedule in terms of rotating breaks, we do just want to please ask everybody to respect everyone else's time, and please make sure that you're back within those 45 minutes. Just to make sure that we're able to accommodate everyone else who has yet to go after you. So please make sure you're back on time so that we can send the next station on their break on time. And then we'll dismiss again around 2 p.m. and we'll kind of just make a last minute announcement to everybody at the clinic, and letting you know that the clinic has ended. And that announcement will come from the pod manager. All right, and then just to give you a visual representation of what to expect from this clinic, this is the walkthrough clinic org chart or organizational chart. As you can see, the pod manager kind of oversees the entire operation. And then you as volunteers fall into some of these subcategories that we'll identify later on when we talk about your specific clinic roles pertaining to whether you're, vaccinator, data collector, things like that. And all of these attachments should have also been shared with you in your deployment summary. We will be sending out another round of reminder emails in addition to some reminder calls that we'll make later on this week, just to remind you before your clinic date, and we'll make sure we get any documentation to you that you need in order to prepare for your clinic. But if you have any questions about that in the meantime, again, please always feel free to reach out to us. This is just what the table layout will look like for anybody who will be at the walkthrough clinic. So you'll have obviously box of gloves, hand sanitizer, gauze, all those kind of things. And then the day of, for your individual JIT trainings, you'll go over all of this, so you'll know exactly where everything will be. And if you need any additional supplies, we will have supply runners constantly checking on you, so you will not have to leave your stations. They will constantly be coming through and doing inventory to make sure that they're exactly replacing precisely what you need. And if you do need anything or assistance, there are signal cards that will kind of cover later on that you'll raise, that'll kind of signify whether you need a med ops lead or a supply runner for more vaccine or whatever the case may be. So all of that has been thought out for you and has been taken care of for you. So all you have to do is kind of sit there, either vaccinate or data collect, and everything should be brought to you. All right, so I tried so many times to flip this over to make this make sense or make this a little bit more visually appealing, but it was quite difficult. So I'm going to use this little pointer. So the way that you'll enter the clinic, you're going to walk through here. So the pointer is this little blue dot right here. So if you follow, you're going to walk through. This is where Brianna and I will be stationed. This is a staff registration table where everybody is going to sign in with us. Whether it's, our PDPH staff and then also MRC volunteers, everyone will sign in at this registration table. You'll get your t-shirts, you'll sign in. If you haven't signed a waiver before, you'll sign a waiver, you'll ask questions. If whatever you need, we can address for you here at this table when you first arrive. And then you can feel free. This is a secure location as well. This is a police training center. So your personal items are safe here, but you can store your bags and personal belongings in this room. Breakfast and lunch will also be served in this room as well. And we do ask that everyone leave their drinks and food in this room. There are no drinks and food unfortunately permitted inside of the vaccination area, and that is just to keep it obviously clean and sterile for our patients. So just to reiterate, all your personal belongings you can safely store in the secondary location here, and it will be safe, safe kept. And then you'll just move over into the vaccination area, which is right over here, where you'll go after the pod manager gives their full just-in-time training. You'll move over into the secondary vaccination area, where you'll be broken off into stations, whether it's station 1, 2, 3, or 1 through 8. You'll be assigned a station. You'll be able to go over all the materials that you have, everything like that. This is kind of how the flow is going to go. So patients will walk through this door. It is roped off, and they'll kind of be guided down here by line staff, and they'll be assigned to the various stations pertaining to the availability that you have at stations. There will be a vaccine assembly unit that will be propped up, which is kind of like a stage, and they will be assembling your vaccines while you're administering them. And so there's, like I said, there's that constant inventory that's being done by the supply runners, and they'll bring you more vaccine, they'll bring you more gauze, whatever, Band-Aids, whatever you need, they'll bring it to you. They have full view of this room as well. And so everything's in full view for them, so they know exactly what you need and when you need it, probably before you do. But this is kind of, just a general layout, and then patients, again, will exit this way, and then they'll leave the clinic. There is a restroom right here. Like I said, everything is conveniently located for you. So restrooms, room number 1, room number 2, those are the 3 rooms that will be in, or those 3 rooms that you need to know about for the purpose of this first clinic. And if there are any questions about that, please feel free to put them in the chat. We'll talk about them later on, but that is, in a nutshell, what you can kind of expect in terms of layout for the first clinic. All right. For the FOP, so the FOP is on Wednesday, October 11th. Arrival time, like I stated earlier, 12 p.m. Between 12 and 12:30 will be the registration. We'll provide all best materials, anything you need will be provided to you during that time. If you want any MRC apparel, please let us know. I'm happy to provide that to you guys. Between 12:35 and 12:45, that'll be that JIT, that just-in-time training for the all staff overview that we talked about earlier. Again, just like for the first clinic, the pod manager will give a very in-depth clinic overview of expectations. Your clinic leads will be identified once again. Between 12:45 and 1:15, there'll be a smaller JIT or just-in-time training with your individual leads. Again, whether that's clinical, data, station assistants, or otherwise. Between 1 and 1:30, we'll make vaccines available for those police officers actually working in the building, or those non-duty officers working in the building, or whoever may be working in that lodge. Will make the vaccines available for them. And just since I'm on the topic, all MRC volunteers are eligible to receive their vaccines at either one of these clinics. So at the very end of the first clinic, we will offer vaccines to anyone who would like them, any staff member who would like them, any volunteer who would like to get theirs. If you know that you want to get it right away, please let me know at registration, or let Brianna know at registration that you're interested in getting your vaccine. We're happy to provide that for you. We'll make a list. We'll come around and ask everyone, and we'll double check as well. But if that's something that you are wanting to get at the end of the clinic, that is something that will be made available to you. So just wanted to put that out there. Between 1:30 and 7 p.m., the FOP flu clinic will run its duration. Again, we may wrap up early, we may not. We may wrap up on time, we'll see. Between 4 and 6, again, will be, Elisa and I will come around and we'll do the breaks. So we'll assign different breaks. And we have this down to a science now, thankfully, after all these years. And so the breaks for the FOP are fairly swift. They're very easy and interchangeable. And so there'll be no hiccups or no gaps with staff. And so that'll again be, excuse me, that'll again be a 45-minute dinner break. We will provide, I believe last year it was pasta, there's salad, I just remember the food being really good personally, especially like after working all day and being on your feet. A hot meal always sounds great. But again, if you do have any dietary restrictions, please bring either your own supplements, for your meal, or snacks, or whatever the case may be. And then there will be refreshments provided to you as well. We'll dismiss everyone around 7. Elisa and I, and that is Elisa and I right here, her and I will be the ones who will break you for both your individual breaks for dinner, and then also to let you know that your station has been shut down. If not, then the pod manager will make a general announcement of either they're going to shut down the entire clinic because we're closing, or they'll individually address the stations that they would like to be shut down. But aside from the pod manager, myself and Elisa will be the only 2 people, assigning breaks. Just so you know where that direct leadership is coming from, it'll come from the 2 of us. So if you have any questions the day of the clinics, you can direct them to myself. If you see Brianna around, you can ask her as well. But definitely, you can also tap on Elisa, and her and I will go back and forth and just make sure that all of your concerns are, addressed. If you have any questions, they're answered, and especially about breaks. Again, with this clinic, if you have to run to the restroom, totally fine. But specifically with this clinic, because it is a drive-through and you're literally standing in between cars, for safety concerns, please notify us, and we will, make sure that all the cars have stopped and that you are safely able to make your way across the drive-through to make your way to the restroom, and then we'll place someone in your stead while you're gone. All right. Here's just an overview of the clinic, or the drive-through organizational chart. Again, as you see, the pod manager oversees everything. Volunteers fall into respective roles underneath. And this is just another visual representation to show like how many people and how many different moving parts it takes to really make these clinics work. These clinics take months to plan. There's a lot of logistics and supplies that go into this, a lot of different moving parts, like I said, a lot of cooks in the kitchen. So we're very thankful to have you all part of this response as well. Just to showcase, how wonderful our volunteers can be, how efficient we can be as a unit. This is what the vaccination table will look like for the drive-through, so a little bit different. obviously because we've had to adjust because it's not a walkthrough, it is a drive-through model. But you'll have essentially the same amount of things and supplies that you've had before. They'll just be located in slightly different areas on your table. Same as the walkthrough clinic for the police training center. Just with the FOP for the drive-through, your supply runners will come through. They'll constantly be doing inventory. They'll constantly be tracking on you, making sure that you have exactly what you need, and they'll be replacing anything that you may not have. And there will be those signal cards as well that you can kind of raise up and flag if there are any issues that you need to be addressed or anything like that. This is the layout for the drive-through. So cars will be coming in. And as you can see, there are stations, I believe it's 1 through 9 this year. Yeah, all right here. There are 3 rows essentially. There are safety zones. The safety zones are essentially if you are, if the cars are moving through, you are standing in those zones as indicated with the legend, and the safety manager will actually signify or signal when it's okay for you to kind of move out of those zones and address your cars and the patients in those cars. The way that we do it for the drive-through, all cars move at once. So it's not, it could be 1 lane moving, and the safety manager will get on his bullhorn and let you know, like, lane 1 is moving or whatever the situation may be. Everyone needs to report to the safety zone. Everyone will stand to the side while all the cars move. And there's multiple stations for safety as indicated with these little triangles here. So we are very secure with this, and we have gotten this down to a science, like I said before. So we are very strict about safety for this clinic. So yeah, just please be careful. Some of the things we require are just, all engines have to be off and things like that, which brings me into my next slide. This is Dan. Dan is our safety manager. We emphasize safety first, specifically for the drive-through because it is a drive-through model. This just tests a different capability within our unit that we're able to, again, rapidly inoculate first responders and moving vehicles if we needed to, because we can do everything. Right. And so all vehicles, I was going to say all vaccines, all vehicles must be completely shut off before proceeding with any type of vaccination or any type of data collection. So vaccinators, data collectors, you would not to step foot towards a car unless it is completely turned off. We use a lot of hand signaling for this drive-through clinic because there is a lot of noise. We are located under a tunnel, so we do have some overview and some cover, but with that, noise kind of, can echo a little bit, and it can become a little chaotic and loud. So we do sometimes use hand signals, and Dan will be there with his bullhorn just to make sure that everyone can hear him when he's indicating that traffic is either moving or has come to a standstill. Again, please do not leave your designated or your assigned work areas without notifying your pod manager or Dan, your safety manager. So specifically for the drive-through clinic, those are the 2 people that you have to notify before you, go run to the restroom or anything like that, because Dan needs to make sure that you are safe. That is his primary concern. We always value the safety of our volunteers utmost. That is our primary concern for any deployment that we have you all involved with. So he wants to make sure you're safe. The pod manager also needs to make sure everyone is safe and knows what, that we all need to put all hands on, on stop, let, people pass through, whatever the case may be. But those are the 2 people that need to know, if you are moving through that traffic, so that they can make it safer for you. And then staff should always take extra precautions when moving among vehicles. Sometimes people don't recognize that they have not turned their car off. We have not had, and I'm going to knock on wood, we have not had any instances at all. We have been 100% safe, and we have kept all our volunteers safe, and that is a big thanks to you all as well. But situational awareness and just being aware of your surroundings is very important for this deployment. So I cannot stress safety enough, but best believe it will be stressed again the day of, because again, we have not had anything happen. Nothing will happen, not on my watch, not on Dan's watch, not on your watch. So we just want to make sure that we keep everyone safe. So that is my safety spiel, and I will leave it at that. All right. Sorry about that. Some do's and don'ts. Please always do please always do, have the patient move the closest to the window before you approach them. Again, that's just a safety thing. Do always remain in safety zones of the vaccination areas when not actively engaging with the vehicle. So if you're not actively taking data collection, if you're not actively vaccinating a patient, please make sure you are standing back in that safety zone. If you're not actively assisting either the vaccinator or the data collector, please make sure that you're standing back in that safety zone so that you're, out of harm's way. And then also just keep in mind to move in sync with your team. That just ties back into situational awareness. You all want to move as one unit, one team. Again, safety first. So keep your squad safe and just make sure that you're aware of, where each other is. There will be 3 of you, and we'll go in more into that when I get into the roles and responsibilities for the clinic. Do not approach a vehicle unless it is turned off. Like we stated earlier, do not enter a vehicle to vaccinate or data collect, meaning if you cannot accessibly vaccinate a patient based on their positioning in the car, please have them come closer to you. If it's a situation where ADA is involved, that's something that we're capable and equipped to address and to deal with. So please just let us know. And I'm sure whether it's Bethany or someone else on site, they'll be able to make sure that that person has the access that they need in order to receive that vaccination. So we are ADA compliant with this clinic, and we can make it work for whoever needs, but we just need to know who needs it. So please just don't enter any vehicle without notifying either your pod manager or the safety manager first, so that we can make sure it's addressed appropriately. And then do not cross traffic lanes while vehicles are moving. That's a big obvious one, but just want to stress that. All right, infection control. Masks will be provided this year, but they are not mandatory. With the heightened COVID cases that are going around, we do recommend them, but again, we are not requiring them. Food and drink, eating and drinking will only be done in the designated areas and away from vaccination areas. That goes for both the walkthrough and the drive-through. Specifically for the drive-through, similar to the walkthrough, there will be a separate designated location where you can store your personal belongings. Again, these are police facilities, and so they will be readily secure in those areas. You'll not have to worry about anything there. So, but please keep all food and drink away from the vaccination tables. They're not to be on them. They're not to be underneath them. They cannot be anywhere near them. I apologize. I love my coffee just as much as the next person, but we cannot have them anywhere near vaccine. Okay, the vaccination areas need to remain completely sterile. All right, so keep that in mind. Even if it's a bottle of water, the bottle of water needs to be in a bag on the side somewhere, but not near the vaccination area. Okay, if you need to take a water break or anything like that, we completely understand. Just please make sure that you communicate that with us. Hand hygiene. Cydni will go over a lot of this in her clinical training, but for hand hygiene, you are not required to wear gloves, but you are required to use hand sanitizer in between and sanitize your hand in between each vaccination. Even if you are using gloves, you do have to sanitize your hands in between each vaccination. Vaccinators and station assistants. Again, like I said, gloves are not required, but they will be provided to you. It's all kind of listed out for you right here. We'll go over specific infection control more in depth the day of, and I'm sure Cydni will touch a little bit about this on her clinical end of the training. But just as some infection control reminders, these are the ones I wanted to highlight and emphasize for you. We're just going to quickly go through the clinic rules and responsibilities. They're pretty straight through. All right, so for vaccine management, there's a vaccine manager, and the vaccine manager, I apologize, the graphic showed up a little bit weird here. The vaccine manager will oversee the vaccination management team. Vaccination runners will assemble the pre-filled syringes and will deliver them to you. Vaccine inventory suppliers will make sure that you have a steady supply of vaccine. They'll track the vaccine inventory before, during, and after each clinic, and that'll be covered more in depth in your just-in-time training the day of the clinics. And then they'll also be on top of determining the pace of the vaccine assembly in terms of the patient throughput that we have and the level and the volume of patients that we see for the clinics. The patient flow tracker is going to obviously track all the patients that come through the clinic. During the last hour, they'll count the patients left and communicate that to vaccine leadership, which will then affect some other decisions that will be made for the clinic. And then they'll assist with the packing or transportation of the vaccine as well. And they'll also be involved in the vaccine assembling in addition to the other vaccination support team or support staff. For the supply team, there'll be a supply supervisor, and then there'll be supply runners. Supply team, supply supervisor, and supply runners, tongue twister. But the supply supervisor will essentially oversee the operation and just making sure that you have the supplies that you need. They'll gauge, the supply inventory for each clinic. The runners will make sure that you have exactly what you need, and they'll be the individuals bringing those supplies to you and making sure that your stations stay stocked. And then they'll continuously, again, monitor any vaccination stations to anticipate your needs, sometimes even before you know they need them. But those will be your supply runners and your supply team. The station assistants this position and role only applies for the FOP for the drive-through clinic, because this is an additional role. Because we are doing a drive-through clinic, the station assistants are there to basically assist the vaccinators by holding or prepping, providing any ancillary supplies that may be needed at the time. They're going to assist, data collectors if they need to, but more so they'll be assisting the vaccinators, and they'll definitely move in tandem with that vaccinator and just help ensure that they maintain flow and safety and avoid any contamination, and make sure that they keep the vaccination area sterile. And then they'll definitely be the point people that, vaccinators, if you're noticing that you're running low or short on something, you can notify our station assistants as well. They also might notice for you, and they may just also let the supply runners know, like, hey, our table needs 1 or 2 more of this, or some more band-aids, gauze, whatever the case may be. And then they'll also be responsible for helping to assist dispose of any debris from any ancillary materials or supplies into the proper containers. And speaking of proper containers, the sharps container, only syringes with needles go in the sharps containers. Only syringes with needles go in the sharps containers. We stress that every year because other things end up in the sharps containers, but because we are very strict with our biohazard, please keep in mind, my clinicians, my wonderful vaccinators, to only put syringes with needles in the sharps containers. And then also do not lock your sharps containers until told to do so. We will more than likely come around and lock them for you at the end of the day. But please do not lock them. If they are full, immediately alert someone from the vaccination or vaccine management team. They'll come address the issue. They'll either lock it and supply you with a brand new one, or they'll see if they can figure out, what the situation is. Sometimes the needles lay weird, but please do not lock the sharps containers. Please let us know, and someone from the vaccine management team will come and again address that. They'll either lock and replace it for you, or they'll just address whatever the issue is. But again, only syringes with needles go in the sharps containers. Okay, and finally, I am going to toss it over to Cydni, and she's going to cover the clinical portion of this training. Again, please keep putting your questions in the chat. I know I just covered a lot. Cydni's going to cover a bunch more, but we'll address everything at the end. And then Cydni, once you're done, you can toss it over to Bethany, and then she'll take over from there. Right.
All right. Good evening, everyone. My name is Cydni Walker. I'm a nurse for the preparedness program. And today I'm just going to go over very brief what is to be expected the day of. I won't be there, unfortunately. Well, fortunately, because I'm getting married, and it also is all these clinics are running into my honeymoon too. So but here's the information. So the vaccine product, like Satorie said, you're going to be administering a Flucelvax quadrivalent. You're going to be giving, they're going to come prepared in pre-filled syringes of 0.5 milliliters. And the needle size we're going to preferably use are 1 inch. We will have a few 0.5 inches, but those are really for those people that really, really need them. This vaccine is a cell-based flu vaccine that's approved for patients 6 months and older. But for this exercise, we're only going to be vaccinating people 9 years and older. This vaccine product, like Satorie did mention earlier, is free of eggs, also antibiotics and preservatives, so the likelihood of someone having an allergy to the product is pretty low. Okay, but we're still going to listen out for that when some screening questions will be asked. We can go to the next slide. All right, so this is just a little bit of vaccine efficacy data related to this product. They looked at different culture-confirmed influenza strains, and so for the age groups of 12 to 17, they found that it's about 60% effective. And then for the vaccine efficacy, for the antigenetically matched culture confirmed influenza strains and all culture confirmed influenza strains were roughly like averaged about 72-73%. And so that's actually pretty good, but we still want to make sure that people know that just because they're getting the flu vaccine doesn't mean they can't get the flu. I feel like we've kind of been talking about this for ages now, but what the flu vaccine is doing is greatly reducing people's likelihood of getting hospitalized or having severe outcomes related to the flu. Okay. So just something for our patients, it's good for them to know. And we can go to the next slide. And so the vaccine, this vaccine is administered in either the right or left deltoid. You'll see that when you're out in the clinics, especially when you're in the cars, it's a bit harder to kind of navigate. And so, but still make sure that you're asking people which arm they prefer. Like Satorie also said, gloves are not mandatory. But you must sanitize your hands with alcohol, with an alcohol-based solution. We're going to have hand sanitizer for you all after each patient. And if your hands do become soiled with bodily fluids after administering the dose, we just expect you to wash your hands with soap and warm water for a minimum of like 30 seconds. But this is all basic information that you guys already know because we're great clinicians. We can go to the next slide. All right, so for people, this is just for people who might need a little bit of a reminder of how to administer a vaccine. Step one, you're gonna make sure you're choosing the correct syringe needle. You're gonna administer the vaccine using that pre-filled syringe that we're going to supply to you. The needle gauges that we're gonna be using are 25 gauge needles. And so you wanna make sure that you're using the correct needle length based on the patient's gender and again, we do have those 1.5 needles if you need it, but there's only a few, so we want to use these sparingly. And then step two, you're going to want to identify the injection site. Again, we're going to be using the deltoid muscle in the upper portion of the arm. I kind of like to think about it, or what they kind of reamed down our throats when I was in nursing school, is that you're going to find the acromion process, then you're going to use 3 finger breaths like down from the acromion process and hit right in the middle in the meat of that deltoid muscle. Your patients will likely thank you because it's as bad as if you were to administer it in a part where there wasn't such amount of muscle. But so just make sure you're using those anatomical landmarks to help determine that injection. Slide. Oh, it says my is unstable. Can you guys still hear me? All right.
We can still hear you.
Okay, good. Okay. So yeah, the next slide is
Okay.
So third, or even before you administer the vaccine, it's really important to ask patients if they have make sure
your sound's going out. Do you mind just repeating what you said? I'm sorry.
Oh no. Recipient, there's any questions that they may have, make sure that they do have access to any vaccine information statements that they might need after the vaccine is administered. Again, ask them if there's any questions, let them know what side effects could be expected and what they can do to help manage those side effects. But if the patient does have any clinical questions, or you have any clinical related questions, especially if it's related to the patient's eligibility, just remember to raise your red card so that medical operations lead can come and find you and answer any questions that you may have. And don't be afraid to ask. There's usually about 2 or 3 medical operations leads on site. And so they're very kind and very willing to help. Okay. And I believe that's it for me. And I can pass it on over to Bethany.
Thanks,
Thanks,
Cydni.
guys.
Bethany, you can go ahead.
All right. Go to the next slide. So I'm going to be presenting on the data collection process. This process will be done kind of before the vaccination process begins, and you'll be working as a team, the vaccinator, data collector, and station assistant, in the case of the drive-through, to make sure that everyone has the information that they need in order to proceed safely and with the right approval. So when you are at the clinic, and you're sitting at the table as a data collector, when you're ready to receive the next patient, you're going to raise a green card, or in the case of the drive-through, there will be a car approaching your station. And the first thing that you're going to do as the data collector is you're going to ask if the person has ever had a bad reaction to the vaccine. So you're going to ask them for their identification, usually a driver's license. It's the easiest way to complete this process. And just check in everyone who is at the table. Usually like family units will come up. So you might have a couple of adults, a couple of children, and just ask for each individual and make sure that you get the answer of whether they've ever had a bad reaction to a vaccine. If the answer is yes for anyone, raise that red card, as Cydni was saying, call over the medical operations lead, and just go through the process with them to verify whether they are okay to receive the vaccine that day. If there are any children in the people at your station, make sure you ask whether they are under the age of 9. We cannot vaccinate anyone under the age of 9. And so this is very important. On the data collection sheet, there will be like the birth date of you must be born before this date in order to receive a vaccine today. So that's a helpful sort of way to double check that. Once you check these 2 questions, then you can proceed with the process. So vaccinators, you're also kind of listening in to make sure that, you know, everyone is over the age of 9 and that everyone is okay to receive the vaccine. You can go to the next slide. So when you receive the patient's ID, there's going to be 2 slightly different processes. At the walkthrough, there's going to be an ID scanner. And we're using a slightly different form this year. If you have done this data collection with us before, it's a little bit easier. It's like a web-based, just like on the browser form. And so it's easy to refresh the page if you need to and reset things and everything. But the ID scanner is still the same. So you just click in that first last name field, scan the ID, and everything is filled from last name all the way down through the address. For the drive-through, we're going to be using a preloaded database. You're going to take that ID, you're going to look for the unique ID, which is essentially the date of birth. So you're going to enter that in the format shown here as 2 digits month, 2 digit year, day, 4 digit year. And that will pull up everyone. It can be a little bit slow. So just something that we learned last year is that if there is any kind of lag or things aren't coming up, give it a little bit to load rather than immediately thinking, oh, there's not a record in here. You can go to the next slide. After you've gathered the ID information, you're going to review that, make sure that everything is correct. And then there's fields for a phone number, which you will get for each patient. You'll ask if they have a twin or a multiple at the clinic. This helps us to make sure that our data is clean and accurate. If we have double names or double date of births, we want to make sure that those are actually two separate people. And for the affiliation, which is just what organization are they with? Are they a LEHB member, which is essentially somebody who is the law enforcement health benefits member. That's the majority of the people who are coming through these clinics. If they are actually on duty, you will check that off as well. And then there may be somebody at your station who is a volunteer or PHMC staff or PDPH staff. So just depending on who's there, you'll check that off. If there is like I said, if there will be children coming through, the easiest way to get their information, if you're scanning IDs, is just to scan the parent's ID again, and then manually change the child's first name and confirm that their last name and address is the same, and edit the fields as needed. You can go to the next slide. So once you've gathered all of their demographic information, you're going to move forward with the vaccination process. So you've gotten all their information, you've confirmed it's correct, you've confirmed that they are eligible to receive the vaccine that day, and the vaccinator will continue with vaccination. You will communicate with the vaccinator and record whether they are receiving their vaccine in the left or the right arm, and you will also record who the vaccine is administered by. So that is the name of the vaccinator, and that will be in the form. There will be a list of people to choose from. So it's possible as a data collector that you may be filling in for someone else's table. You might move around, even though you'll generally kind of be in one place for a while. So just make sure that you're choosing the correct vaccinator name based on who you're working with at that time. And then there's the final step is a date field, a date and time, and there's just a little now button. You can just click that. You don't even have to type anything in, just click now, and then you'll hit submit, or in the case of the drive-through, you'll hit save and exit the form. You can go to the next slide. So just a couple of notes, just like we have the red cards to call over the clinical lead, we will have blue cards. Those are to call over the data lead. So myself, my colleague Katie will probably be the ones who are sort of making the rounds. We'll be keeping an eye out. If you have any tech questions whatsoever, anything happening, just raise a blue card. We'll come over and troubleshoot it with you. If you're unable to find someone, in the database at the drive-through, like I said, it can be a little bit slow. Occasionally there will be folks who are not in the database, and if that's the case, you'll just enter the 9999 as the unique ID and just fill in the fields with a new record. If you make a mistake, you can reload the page and just start fresh, clear the fields. And in the case of the walkthrough, you'll be sitting at a table. You'll have the opportunity to use a notepad, write down phone numbers, things like that you may be needing to enter for multiple people in a family unit. And then next slide. I think that might be it for me. Yep. Hand it over to you, Satorie.
Thanks, Bethany. I appreciate it. So now I just wanted to say thank you to everybody who, spent your evening with us to go over our first responder flu clinic training info session. I hope this was informational or informative to you. I hope we were able to, kind of address some things for a lot of people who had a lot of questions. Right now, I'm going to just stop sharing my screen. Actually, I'm going to share my screen one more time because I want to share with you our contact info. That's the last slide. Yes, so always feel free to contact us with any questions, concerns, or for any additional information. If you need us, we're here for you. That is my personal cell phone number. You can please feel free to text me. If you call me, I do have a just text me would be preferred, but you can call me, leave a voicemail. I do have a spam blocker, so sometimes it may not always get through. But always please leave me a voicemail or follow up with a text. I will 100% get back to you. There's our MRC@FOLA.gov email address that you can email us at if you have any direct questions. We do post some of our volunteer highlights and deployment updates and opportunities on our LinkedIn page. We do have a YouTube page as well if you want to check out any recorded or previous trainings that we've done as well. I will be posting this training to that YouTube page shortly. And as always, you are all familiar with the CERPA website as well. So if you need us for anything, we're here for you. I'm going to, at this point, stop sharing my screen. Thank you all so much again for your time and your attention. And I'm going to kind of just turn it over to the chat and see what questions we have. All right, so I'm just going on the list. So first question, have assignments for October 11th been sent out yet? Yes, a good portion of them were. We're just waiting on some confirmations. The way that we staff these deployments, they're first come, first serve. So the quicker you sign up for them, we pull the exports from them and we staff based off that just to make sure it's fairly equitable, or fair to everybody. So we do staff first come, first serve. However, there are deadlines and due dates for people to respond and RSVP for the clinics. I believe that is, and Brianna can correct me if I'm wrong, I believe it's this Friday. We sent out the email for the flu clinic for October 30th. And I think the deadline was for people to respond either this Friday or next Friday. But the way that works is essentially after we haven't heard back from the people that we initially reach out to with this opportunity, we do pull names back from the other exports, and we do staff accordingly as well. So we try to give everyone a fair chance. If you want to reach out to us individually and just email us, or if you want to text me with some specific questions, please feel free to do that. But yeah, that's if that answers your question. If you have not already received a deployment summary for the Saturday's clinic, unfortunately, you were not selected. And that is, again, we just staff first come, first serve. Those who, rapidly sign up do have a better shot of getting staffed. But in the future, if you know this is something that you definitely 100% want to do, you can reach out to us individually. And if the role's available, we'd be happy to, to staff you as early as possible. I start staffing for flu clinics the year before. So it's never too early to sign up literally for anything. If there's any deployment that you're ever interested in doing, just let me know. I'll put you on the list and then I'll contact you when that time comes. You can sign up as early as now. So if you know that this is something you want to do next year, send me a text or shoot me an email, and I'd be happy to make sure that I put you on that early sign up list. If you emailed us, both Brianna and myself do oversee that inbox. We will be combing through the inbox as well, just to make sure that we do hit all those responses and we answer any questions that may still be lingering. So if you find that you haven't received a response from us, we apologize. We will respond to you. Please be kind. We do have over 7,000 of you guys, so we do try to make we do try to respond as soon as we possibly can. But again, you do have my cell phone number. Please follow up with a text, voicemail, call, whatever you think will work best. And I will get back to you. It looks like Brianna hit all the other ones in the chat, so thank you for that. Thanks, John and Julie and Charito. I really appreciate y'all. I appreciate everybody for being on this call. Thank you, Bethany, for doing your portion of the presentation. I hope everyone has a wonderful evening. If there aren't any other questions, we can call it a night. Otherwise, I will hang out for a few minutes. I mean, it is exactly 7 o'clock, so we are right on the nose with timing here. I do want to be respectful of everyone's time. I will personally hang out if you have any questions, or if you want to talk, offline, one-on-one, we can arrange that. Other than that, thank you all. For those of you who are going to be at these clinics, I am so excited to see you. And for those who are looking forward to an opportunity like this in the future, I'm so happy to have you. But yeah, thank you guys so much. I appreciate it. Like I said, I'm going to hang out for a few minutes. Bye, Charito. Thank you. Have a great night. It was great having you all in this training. If there's any lingering questions, now would be the time to ask them. or if you want to speak to me one-on-one, feel free to unmute yourself, add anything to the chat. I'll let her know. Thank you, Christina. I know she's getting married. I'm jealous. Thanks, everybody. Thanks, Kurt. Have a great evening. The subject line for the emails for both of the clinics will be Philadelphia MRC. All of our email subject lines will start with Philadelphia MRC, and then I believe it's, we'll reach out to you because I believe you are either on the list or let me see. The subject line will be Philadelphia MRC First Responder Flu Clinic, and then it'll have the date next to that as well. So double check your inbox. If you didn't receive anything from us, please shoot us an email, or like I said, you can text me and we'll figure something out. But all lines of communication are open for you guys, so please feel free to reach out. All right, anyone else with last minute questions? I see a few people still on the call. Okay. All right, thank you guys. Have a great evening.
Good night.
Good night. I'm gonna stop this recording.